Say hello.
Hello.
There's a baby. Okay. All right. Okay. Hello, my name is Blake Cheatham, and I am currently studying physical therapy at Washburn University. Everyone at some point in their life can benefit from a physical therapist, whether it's treating a minor back pain or rehabilitation after a major surgery. Many people now rely on physical therapists to restore them to a happy, functional, and active lifestyle. Physical therapists as a profession has come a long way. Physical therapists were first established in Sweden, initially called a psykgymnast, translated exactly to someone involved in gymnastics for those who are ill. The polio epidemic called for the need of physical therapy and then further established through World War I, II, and the Korean War, when the need for rehabilitation efforts were drastically increased. After the wars, the evolution of physical therapists slowed slightly, but remained consistent through time. Now patients are able to refer themselves to a physical therapist without consultation from a physician. The vital role of a physical therapist in the healthcare system took a good amount of time and many forms of service to become truly established. Okay. The first of those that were considered PTs were a group of gymnast instructors who specialized in massage, manipulation, and exercise back in 1813 in Sweden. And then in 1851, German medical journals progressed the term physiotherapy to physiotherapy, and then finally to physical therapy, which obviously still sticks around today. After those took place, the next big advancement for physical therapists was the polio epidemic. Real advancements in the practice came in 1916, when the polio epidemic called for young women to treat polio patients that had paralysis. During this time, manual muscle testing was established, which is now the most common technique used across the medical community to test strength and control of injured or atrophied muscle. The US President Franklin D. Roosevelt's polio was also partially treated with physical therapy practices like hydrotherapy, which led him to purchasing a resort in Georgia dedicated to hydrotherapy and gained a lot of media attention at the time to physical therapists, which were fairly unexperienced and not very well known. So the First World War called 16 million people to the battlefield. The U.S. entered the war in 1917 and started the formation of many training programs to rehabilitate the large number of injured soldiers, obviously coming back from the war. This started the close relationship between physical therapists and the surgical community in order to supply the demand imposed upon the military's medical department. World War II again showed the dominance of physical therapists' role for returning soldiers. Things like amputation, burns, cold injuries, wounds, fractures, and nerve and spinal cord injuries could all be partially treated alongside physicians with physical therapy practices. So, during the World War II, the use of electrical stimulation began and is widely used in today's medicine, along with sports as well. This innovation gave physical therapy new direction, not just to prevent and stop atrophy, but to regain strength and function. By the end of the war, for the first time, physical therapists were gaining their own respective military rankings. After the war ended, the need for PTs declined and training programs were suspended, while acting practitioners that participated in the war were initiated into their own positions in the Army Medical Specialist Corps. In the 1950s, PTs progressed from technicians to professional practitioners. Many different practitioners in the post-war era established the credibility of the physical therapist. For instance, proprioceptive neuromuscular facilitation, or PNF as many people just know it now, was created to rehabilitate children with cerebral palsy, a practice now vastly used in sports and medicine as kind of a stretching technique that relieves a lot of muscular pain. PTs also discourage the use of extensive bed rest in patients with myocardial infractions, substituting it with physical activity, changing the view of many rehabilitation programs throughout all of medicine, from more of a bedridden state to more active, to be able to increase the stability of the heart. The Korean War presented another need for PTs. The large number of neuromuscular injuries spread over the small amount of orthopedic surgeons available to the military at the time called for PTs to be credentialed to evaluate neuromuscular patients without the physicians, further establishing the independence of PTs at that time. Times of peace allowed PTs to venture out of hospitals into their own practicing environments. The physical therapist soon became a highly certified medical professional, now requiring a doctorate degree and many state licensing requirements. Physical therapists now work as a fully functional part of the medical community and can treat patients without referral by a physician at all. In the 21st century, physical therapy as a profession has continued to grow in all areas. Scientific research needs, education standards meeting the demands of the healthcare system, federal and state laws meeting the needs of the growing profession, and continuing renovation around current healthcare reform politically. Corporate physical therapy organizations are growing in size and independent facilities alike, growing consistently with the market size of physical therapy. Physical therapy is expected to keep growing far into the future as more and more people realize the role and importance in the medical community. Supply and demand has carried the practice of physical therapy through various respects, from gymnastic professionals in 1813, rehabilitation of polio and cerebral palsy in the early 20th century, soldiers returning from war, and now treating a generalized population like they do today. The modern physical therapist practices in many different settings across a broad spectrum of the patient population and is now a very vital part of today's medicine for all people. Thank you.